Uh, Greetings from Center Rheumatology and Immunology Center. Today we practice what we call as Ankylosing Spondylitis Awareness Day. As you are aware, Ankylosing spondylitis is an young man's disease. It
Sorry
occurs in
to disturb.
a young.
Sir, sir, can you please check the internet once?
Ikkada.
Sir, mobile internet.
It's not.
It is connected, sir, but somehow it is not clear.
Not that clear.
Yes, sir.
Could be it's there adequate.
Yes, sir. Now it is.
I think we have to restart.
Yes, sir, please.
Today we practice what we call as Ankylosing Spondylitis Awareness Day. As you are aware, Ankylosing spondylitis is one of the common disease which affects the younger patients, but it is less common than the back pain of other causes. Usual presentation is it starts with a stiffness in the back, especially when you get up in the morning. Back remains stiff for more than half an hour to 1 hour. And once you start moving, being active, do little exercises, do some smaller minor works, you start getting it relaxed. But when it is too worse, it will even cause a trouble for you to sleep at night, roll in the bed, and also even to get up from a sitting position. As it progresses, it can also affect other joints, especially hip joint, knee joints, and unusually the shoulder and small joints of the hands. Rarely it can start from the other place. It can start from the joints and then can move towards the back joints. The characteristic feature of it is affecting a sacroiliac joint. It's a joint which is at the pelvis, between the pelvis and the tailbone, where you have a sacroiliac joints, which is commonly affected, as a consequence of which the individual who suffer from this arthritis will develop severe back pain, stiffness, and difficult to move, especially from the resting position. Once you are active, you can definitely be very active and mobile. So most important thing is to identify this as an ankylosing spondylitis, because as I said, back pain because of lack of exercise, lack of muscle strength, sometimes even a minor vitamin D deficiency can produce backache. Wrong posture, which is the most commonest reason for the back pain, especially in young men who are in IT professionals, sit in front of the laptops and their mobiles for a longer time with an hunchback. They all develop a back pain. But the back pain in that position is usually a pain which comes when you sit or stand for a long time, rather than in ankylosing spondylitis, where when you rest for a long time, either sleeping or when you sit in a same position for a long time, back starts hurting. Little bit of movement, it definitely relieves the pain. Other confusion that we have, which I want to clarify in this day, is we often think that the presence of HLA-B27 means ankylosing spondylitis. So it not necessarily. HLA-B27, when it is present, only 1 out of their 10 of them will develop ankylosing spondylitis. So there is no need to test for HLA-B27 for everybody who has a back pain. And not always necessary you have HLA-B27 and then you have an ankylosing spondylitis. Check with the right rheumatologist, take his consult, ask him to, he will examine and will confirm whether you have ankylosing spondylitis or not. Most crucial thing is early diagnosis. If you diagnose early, take proper care, including the good amount of exercise, especially of the back. Even the yoga asanas like Surya Namaskara, etc., which has more focused on the back, will definitely help you to keep yourself healthy and better. In addition to that, you may need to take some of the medications, which includes simple drug like sulfasalazine, methotrexate, and a little higher end medications like biologics and NIPs called tofacitinib. So overall, if you have ankylosing spondylitis, you need not be afraid. You need to figure out the diagnosis. Once you have diagnosed, take proper care. You can definitely lead a normal life. So be aware, a back pain could be ankylosing spondylitis. And also remember, not all back pains are ankylosing spondylitis. And also need to remember the message I would like to give all of you is you have ankylosing spondylitis doesn't mean that's the end of the life. If you really manage ankylosing spondylitis with good exercise, physical activity, and a proper treatment, you can lead a normal life. So, with this, I say a final note. Ankylosing spondylitis, don't be afraid. Take a proper care. You can have a good quality life. Thank you.